everybody, it's Tammy Allenbaugh. Welcome to my first podcast. I'm so excited about the topic we have today, customizing your massage. Super critical. We are service providers, but we are in the customer service business, and your business just happens to be massage therapy. I can't express enough how important it is to customize your massage. So to illustrate the point, I will give you a situation that I recently experienced when I was on the table, okay? So the session that I received was an 80-minute hands-on. The therapist asked me when we got started, because I hadn't seen him before, he was able to access my history, so he did follow up and clarify. So I see on your forms that you cycle, and I said I do. And he didn't ask me how many miles or if it was indoor or outdoor. He didn't ask any follow-up questions. I said, yes, I do cycle, and I need extra time on my quads and hamstrings today. So I don't care when I'm on the table, if I'm face up or face down, it doesn't matter to me, just do what I ask. And he started me face down, which is fine. So he uncovered my back and started with my back first. So since I was staring at the floor, I wasn't sure how much time had gone past in the service. But it seemed like I was in that position for a long time. He did work on my back, and then from that position, he did work on my arms, both sides in that position, which is fine. So it just seemed like he was in that area for a long time. So here's me in the session. I'm staring at the floor, and I kept wondering how many minutes has he completed. It seems like an eternity. So I finally peeked up and I asked my therapist, how many minutes have we conducted in the session? So guess how many minutes we've already completed. It was 80 minutes hands-on, and he started with my back and arms. How many minutes do you think he spent on my back and arms? Keep guessing. I'm going to say higher than what you just guessed, but to illustrate, 52 minutes on my back. He spent 52 minutes out of 80 on my back. That wasn't the area that I requested. I was so frustrated. And he finally transitioned to my legs. So he spent, again, I'm face down, 2 minutes on my right leg, 2 minutes on my left leg. Then he flipped me over and he worked on my left leg for 2 minutes and my right leg for 2 minutes. And I know that because when he transitioned to face up position or supine, I looked at the clock and it said 6:16. When he went to drape me back completely, I looked at the clock again, it was 6:18. So let's do some math. So he spent 2 minutes here, 2 minutes here, 2 minutes here, 2 minutes here. So 8 minutes out of 80 on the lower half of my body. So he spent 10% of his time on the lower 50% of my body. And that just didn't make any sense to me. So when I could feel him transition around to the head end of the table, I gave him a prompt and I said, look, however many minutes we have left, can you go back over my quads, and now that they're warm, can you put your forearm or your elbow in there? And he did comply, but then he proceeded to tell me, well, most people that come in here, they don't want that much time on their legs. Well, that just told me he didn't customize the session for me. And I would say that I probably wouldn't refer him, and I 100% won't go back to him for treatment. So fast forward, 2 months later, I go in for therapy. Again, it's an 80-minute session, but this time I walked in with a list of demands. I needed so much relief from cycling. My legs were trashed. I didn't get relief the last session, so I walked into this lady's office and I said, look, I have a very specific set of demands today. I need 10 minutes on this leg, 10 minutes on the front of my left, 10 minutes on the back of my right, and 10 minutes on the back of my left. So in essence, I need you to spend half of your time on the lower half of my body. And guess what she did? She knocked it out of the park. She was a rock star. I didn't rattle her. She didn't seem insulted by that specific time request that I made. She just got to work. And I walked out and tipped her $50 because she actually listened to what I wanted. She not only listened to what I wanted, but then she actually did what I wanted. That is so rare. I've had a lot of massage sessions and 21 years. I've been a therapist for 21 years, and I get regular massage. And that's exactly what I'm looking for, is a customized treatment. So when you have a client that's never had a massage before, I understand that it's a little bit of a scavenger hunt. They don't know what they want. You don't know the areas just yet that they need more time or less. So you're both trying to figure things out in the first session. And you can get away with that generally and do an okay, thorough massage your first session. But when you have an informed consumer, especially an athlete, when they come in and they have specific requests, you have to fit that in. And when I coach new therapists, if you have that situation and they offer a specific request, then try and fit that in at the beginning of the session so you know you got that in. Okay? Again, I cannot stress enough. When you have somebody that comes in that's an informed consumer and they give you a specific request, just do that. It's your best day. You don't have to guess what they want. Just do that. Okay? So having said that, as a professional, if your client comes in and they request something that's obviously contraindicated, then you need to jump in as a professional and say, look, obviously I can't massage over that open wound. Obviously I can't work in an area where you've had a recent hip replacement. Obviously it's too soon. I need a doctor's release, etc. If you're over 9 weeks pregnant, I need your physician's medical release. I understand all of that. But when your client's on the table, it's their session. Stop working the way you want to have work done. Because I've also been on the table when therapists have told me, I can't believe that you like that much pressure on your legs. When I'm on the table, I don't like that much pressure on my legs, so that's why I don't do that much pressure. Again, you've just told me that you didn't customize my massage for me. So stop working the way you want to have work done. Listen to your clients. If they have a specific request, try and fit that in at the beginning of the session. And remember, therapists, if you don't take care of your clients, somebody else will. Okay, guys, get back to work. See you next time.